parts of the nasal cavity. But what we have out here is a membrane. This is the dura mater that we're looking at here. Okay? So the meninges are in place on this brain. All this other stuff, I have no idea why it's here. So I'm just going to go and trim it away. And then we're going to work with the meninges first. So I'm going to trim this away. I have no idea what this is and why it's there. Oh, I see. Okay, that's got the olfactory bulbs in it. Okay, so I've cleared off a little bit of that. All right? Okay. This here appears to be the bones of the ethmoid. Okay? And so you can feel it. It's bony. And I think they left this in place because the olfactory bulbs are associated with this bony material. This is an inferior view. As we move posteriorly, we see the spinal cord back here. Spinal cord there. And then we see a bean-shaped gland right here. This is the pituitary. So anterior and posterior. And we have the spinal cord back here and the pituitary in the center. Okay? We see that the brain is essentially encased in a sac. And we're seeing the dura mater. And we're going to eventually remove this dura mater so we can see the surface of the brain a little bit better. The way in which to remove the dura is to use this tool here, scissors, and start back here at the spinal cord and begin to cut through the dura, but stay shallow. Don't cut into the brain tissue itself. I've made a cut exposing the brain stem, the medulla oblongata. I'm then going to, stay with me now, I'm going to continue, and I'm actually cutting through a little bit of bone of the sphenoid here, and I'm going to continue to make my cuts, and it may get a little difficult, but I'm going to stay shallow, and I'm going to continue to cut through the dura as I work around the area of the diencephalon. So what you're trying to do is to remove the dura as one piece. And let's see how I did. Oh, I missed a cut. This is what you want to end up with. This is the dura mater. And what I've done is I've made cuts around the inferior portion of the brain to release the dura from its attachment points. Okay? This is the posterior portion. This is the anterior portion where the people who provided this for you provided some of the nasal tissue. The olfactory bulbs would be associated with this. This is the dura mater. There's a couple of places where the dura is very thick. And these places have special names, which I'll tell you about in a minute. So you will encounter two places where you've got to cut deep to get the dura removed. If you have any trouble, I'm here to help, so call me over.